Good morning, everyone, and welcome to today's Ethnic Media Services news briefing in partnership with the California Department of Public Health's Vaccinate All 58 initiative and the California Department of Aging. I'm Sandy Close, Director of EMS and your moderator for today. Our focus is on residents of long-term care facilities in California and the issue of residents' rights. The topic is one of growing concern for advocates of older adults and people with disabilities in the wake of the pandemic, during which residents suffered not only high infection and fatality rates, but prolonged quarantines and isolation. What rights do residents of long-term care facilities have? And how do residents make sure those rights are met? An October 5th memo from the Centers for Medicare and Medicaid Patients reminded nursing homes, for example, that they must have a plan to support residents' right to vote. How many long-term care residents ensured that their residents were able to vote? The right to vote is just one in a list that includes the right to access health care, such as vaccines and boosters, the right to culturally appropriate food and holiday celebrations, the right to an essential quality of life. These rights are a high priority for the California Department of Aging, whose conference recently on its master plan is what really awakened me to this issue. It's also, of course, of concern to the California Department of Health's Vaccinate All 58 campaign. Our speakers today include Hagar Dickman, staff attorney for California Justice and Aging, Dr. Anna Chodos, associate professor of medicine at Zuckerberg San Francisco General and of geriatrics at UCSF, Jerry Kirouac, who oversees 70+ facilities and 25,000 long-term care residents as program manager and long-term care ombudsman for the Area Agency on Aging, and 3 residents of the Redding Veterans Home in Redding, California, who are particularly concerned about the right to vote. They include Billy Ball, Billy Thomas, and Linda Lejau. We are also hoping to be joined by Blanca Castro, a fierce advocate for long-term care, resident care rights as the state's long-term care ombudsman. And I believe Blanca has just joined us. Wonderful. So we will send expanded bios of all our speakers following today's briefing, along with a video. And we are live tweeting today's conference and live streaming it. So please realize we will be sending the video to all our attendees and to RSVPs who were unable to make the call. We ask our speakers to speak slowly for our interpreters, and we ask our reporters to enter your questions in the chat box. We will take questions at the conclusion of the panel. So wonderful. Blanca Castro, could you please open our conference today with an overview of long-term care facilities in California? How many residents are there? And what is your concern as the state ombudsman of long-term care about the issue of rights.
Thank you so much, Sandy, and thank you for setting this very important briefing to our media. First and foremost, my name is Blanca Castro. I am the State Long-Term Care Ombudsman in California. That's a Swedish word, and what it means is advocate. There are about 300,000 people on any given day in California who, for whether or not they're there for a short term, after surgery, maybe they have hip surgery, maybe they have surgery, heart surgery, but they go into either nursing homes. For the most part, we have about 2,000 nursing homes in California. And then statewide, we have almost 12,000 long-term care facilities. These are assisted living facilities. These include residential care facilities. Some of them may have community care that's a continuing care community. So you may start out independently and then you will progress to more advanced care if you need 24/7 care. But it's important to note that when you're in a skilled nursing facility, there are 3 ways to pay for your care. Medicare pays for the first 100 days. If you need longer term or longer stay after that, you either pay through your health plan, which you might have a private plan, and you were lucky to have a long-term care insurance, or Medi-Cal, the Medicaid program pays for it, which requires many people to either remove many of their assets so that they can become eligible for Medi-Cal. And many of the people that are in long-term care facilities who are not able to pay on their own or don't have long-term care insurance are low income. What's important to note is that just because you go into a nursing facility or long-term care facility, you are still the same person you were before you entered. You still have a name, you still have family, you have a history, you have life experiences, you still matter. And the role of the long-term care ombudsman is to basically ensure that if somebody is not being given the level of care and being treated with respect and dignity when they are in a long-term care facility, that we will we'll communicate with the resident. We are here specifically for the resident. What makes our role unique, we are not an enforcement agency. So there are over 700 long-term care ombudsmen across California, 35 programs statewide, and we're funded entirely by state taxpayer funding. That is through the Older Americans Act and through the Older Californians Act and General Fund. So your taxpayer dollars go to caring for individuals who are in long-term care settings. And as I said, some people are there short-term, some are there long-term. But what we want to talk about today is that every individual that is in a facility has rights that must be protected and must be honored. For example, if you are being forced to eat at a certain time, or you're not being given a bath when you want it, or when you press a call button because you need assistance going to the restroom and you're not having somebody come and help you in a timely manner, or they ignore you. It's been, hours. Those are your rights. So advocates, our long-term care ombudsman, we get calls. Last year in 2021, we had almost 40,000 complaints. They range from inappropriate discharges to medications not being given to anything from, and many of you knew, not having visitors. So in a nutshell, we're your voice. We're there to work with staff. We're also there to work directly with the enforcement agencies, the very agencies, Department of Public Health, Department of Social Services, Department of Justice, whatever the situation is. We will first try to work with administrators and staff. The main question we ask the resident by name, what do you want? What does resolution look like to you? And then we go from there. Do we always solve every single situation? Absolutely not. But our goal is that the dignity, respect, independence is always first and foremost. And if the individual is unable to communicate directly to us, there may be unable to communicate verbally, they might have a power of attorney or a representative. We will work with their family. So there is a crisis line. We have a 1-800 crisis line that we will share with everybody here. We'll mention several times on the call, and anybody can contact the Long-Term Care Ombudsman. It's important to know if somebody is complaining. One of the unique things, because we are here for the resident, if that individual refuses and does not give their consent for us to investigate or for us to raise a problem, we have to honor that. So we are there for the resident. Unless it is a very egregious physical abuse or somebody is in serious danger, then we will bring in law enforcement. But we have to always ensure that the resident has given us consent and that we are providing them with the level of support that they're asking us to provide them.
So one quick question, Ms. Castro, before we move on. What brought this to a kind of major top of the agenda concern during the pandemic? What made you wake up at night worried about this issue?
Thank you, Sandy. We are social animals, human beings. We need touch, we need voices, we need contact. And unfortunately, because there was so much information out there, some that was science-based, some that was not, but facilities essentially locked down. So residents became prisoners for all intents and purposes. They were not allowed to go out, and they were not allowed to have any visitors come in. What that has taught us and what kept us up at night is that it didn't have to be that way. What we learned from the pandemic is that every long-term care facility, and now we know this because it's a requirement, must have an infection control plan in place. So every individual that works there, that visits there are protocols to ensure that if there is an infection, how do you mitigate, how do you prevent it from spreading? And some of those things were not being done, such as washing your hands in between caring from one resident to another, making sure you're not using the same towel for one resident to another, ensuring you're wearing a mask if you might feel like you have a cough, or not going in at all. So now there are very specific requirements for all facilities that they must maintain. And that's what the regulatory agencies are checking on. But what we did learn is that the isolation, not only did it harm the fact that people were unable to see their loved ones, it actually made their conditions worse. Many people who had maybe early onset dementia were much more severe at the end of the pandemic. People who already had some chronic conditions, they maybe they died an earlier death, and many people were unable to put closure and be with their loved ones as they were passing from life to death. So what we learned is that is not policy. That is no way to run what is part of our long-term care and healthcare system. And we have now in place very specific laws. One that was passed this year, AB 895, it does require that upon admission, a resident must know the name of the contact for long-term care ombudsman. And then we had another law passed that requires during a public health emergency that ombudsman will not be prevented from entering a facility.
Thank you so much. Ms. Dickman, I'm going to go directly to you and then go to Dr. Chodos third, because it's such an important follow-up. You are with Justice in Aging, a foremost advocacy group on behalf of the rights of older adults and people with disabilities. Can you build on what Blanca Castro told us and give us a better, is there a Bill of Rights for residents of long-term facilities? Where do we find, I didn't know about the two laws that Ms. Castro just mentioned. Please.
Well, thank you so much for having me. The main law that regulates nursing homes and nursing home rights is actually the Nursing Home Reform Act. It's a federal law, and it applies to every nursing home that is certified to accept payment for Medicare or Medicaid. And because almost all nursing homes accept that form of payment and are financed by either Medicaid or Medicare or both, most nursing homes are regulated by the Nursing Home Reform Act. Foundationally, the Reform Act requires that each nursing home provide the care needed by a resident to reach their highest practicable level of functioning by providing all necessary and appropriate care for a particular resident. Or in other words, person-centered care that is guided by and respectful of what each resident as an individual needs and what they want. So I thought I would give just an overview of some of the rights that are contemplated by the Act. For example, all residents are entitled to the same level of high quality care and services as other residents, regardless of the form of pay. So that means a Medicare resident is entitled to the same, or a Medicaid resident is entitled to the same care as a Medicare funded resident. Nursing homes can't deny one-on-one care to a Medicaid resident, but provide it to one using Medicare. And nursing homes must provide all necessary care. So the nursing home can't say, we don't have financing for the kind of care that you need, so you need to pay for your own private duty aid to replace that, to fulfill that need. Nursing homes also have to develop comprehensive person-centered care plans with the full participation of residents and their family that is routinely reviewed and revised to reflect residents' needs and wishes, which means that the nursing home can't create a care plan without actually discussing it first with the family and the resident. And care planning meetings have to be planned at times that are convenient both for the resident and for the family members. Nursing homes have to make reasonable adjustments for resident needs and preferences to reflect resident choice and provide person-centered care. So like Blanca mentioned, there can't be a requirement that all residents are at 6 a.m. There can't be a requirement that meal times are at specific times. There has to be flexibility on waking times and sleep times, on desired food, and what chosen activities residents want to participate in. Residents have a right to be free of physical and medical restraints unless they are used to treat a medical condition or symptom. No medical or physical restraint may be used for convenience or discipline. They require the consent of a resident or their family member where appropriate. So even, I'm sorry, go ahead.
Ms. Dickman, we, unfortunately, Dr. Chodos has a hard stop at 10:30. So
I'm actually okay. I can hang on. Yep.
Okay, great.
No worries.
I'm so sorry.
I can also speak really fast.
No, please don't talk fast because the interpreters will have
Yes.
a hard time. But all the rights you're saying will raise the question of just from Justice in Aging's point of view, to what extent are our long-term residential care facilities observing these rights? How worried should we be about the extent to which people with cognitive problems, for example, are severely disabled or confined to beds? How well are these rights being enforced for them?
Well, I think you know, the Reform Act sets out quite a comprehensive list of rights, and as with most laws, there's always a difference between what rights are available and who and how those rights are being enforced. And unfortunately, enforcing these rights falls to residents and their family members. And enforcement requires awareness of the right, familiarity with the processes for enforcement, so grievance procedures, appeals procedures, and then the confidence to pursue that enforcement without fear of retaliation. And I think those sort of three concerns should be at our forefront when we consider how effective are these rights, and where should we be looking to make sure that nursing homes follow them. Barriers to right enforcement is particularly important to consider in light of the well-documented racial disparities in quality of care in nursing homes. So that Black Americans, for example, are 3 times more likely to reside in poor performing or lower quality nursing homes than white Americans. And the severe consequences of these disparities were highlighted in the pandemic, where residents of color were disproportionately killed by the virus. So whatever we as advocates do to ensure that we have robust enforcement has to really be seen from that light of disparities and who's really able to, who is suffering from poor rights enforcement or from the presence of these rights, which facilities are actually following them versus not. I think also has presents some racial disparities, and so we should really focus that advocacy on enforcement with that in mind.
Great. There are questions in the chat, and I hope you will check them out because there's some you may be able to answer in the chat as we move to our next speaker, Dr. Chodos. And I hope all of our subject matter experts will stay on because we will be coming back to you with questions. So, Dr. Chodos, you are both a teacher and somebody who provides care on the front lines. How worried are you about access to, for example, vaccines and boosters in nursing home facilities, for example? And I'm not too sure I understand the difference between nursing home facilities and long-term residential care facilities. We're really talking about the same thing, but some seem to be more informal and others seem to be more institutional.
Sandy, you bring up a critical point. I think you're not alone in not understanding it. I think most people are confused, and I would include most healthcare professionals in that. I just want to quickly identify that I do clinical care in clinic, so I'm an outpatient doctor most of the time. For the COVID response, I was incredibly privileged to be able to be a part of that for our city and county of San Francisco, and was doing nursing home and assisted living. So there's crossover there in terms of some of the issues. I was doing outbreak response work, and that was before vaccines. So in the last months of 2020, the summer and fall. So I sort of saw pre and post vaccines in nursing homes and assisted living. I'm sure Blanca wants to jump all over this, but I will say briefly, skilled nursing facilities and assisted living facilities or residential care facilities for the elderly, from my perspective as a physician, often have the same people, very similar people who are very frail or have a lot of care needs can end up in either. However, skilled nursing facilities often have this acute rehab component. They have often more, I would say, functionally or physically and cognitively disabled people, but we don't have a systematic way of deciding always what people need and where they end up. And a lot of it has to do with resources, what's available at the time, what someone can afford. It's a big mix of stuff. The other thing is skilled nursing facilities are regulated by the Department of Public Health. and CMS, or the Center for Medicare and Medicaid Services, and then the California Department of Social Services, I believe the CDSS regulates like residential care facilities and
That's
assisted living.
correct.
Okay,
That's
thanks,
correct.
Blanca.
And,
yeah, I
and-
shouldn't be
and-
talking about this.
No,
You should.
Just real quickly, the skilled nursing facilities do have a 24/7 medical care. So they have they'll have a director of nurses, they'll have a medical doctor, they're required to. Whereas assisted living or residential care facilities, they're not allowed to, and they shouldn't be accepting individuals that require medical care. They may have some sort of medical need, but it should be very light. So that would be the two differences.
That's the idea. And I guess to really underscore, like assisted living or residential care facilities of the elderly, I sort of use those terms, they get kind of mixed up, but they're not required to have healthcare, and they have, they're essentially considered social care, or like in the social care model. What I will say though is medically, we see a lot of the same issues. The risk factors that led to very serious COVID risk were very similar, meaning communal living, individuals with a lot of predisposing factors to serious illness. And I think the thing, Sandy, I really appreciate your question about what worries me. And I think what we know and what we've seen is that vaccines completely turned the ship around in terms of how serious the risk was to these adults, and any drop in taking that seriously, meaning people not getting vaccinated for COVID-19, not getting boosted adequately, does put people at risk. One thing I think about a lot and was very clear was we have a very small percent of our overall California population. They are a very important part of our community and our state, but a very small number who are typically in a skilled nursing facility at one time. Less than, my understanding, given the numbers you quoted, Blanca, would be far less than 0.1%. I think it's even less than 0.01% at a given time. However, a total as of today, they've been at least accounting for 13% of overall deaths. So it's just hugely imbalanced, and it is not entirely a issue of who those people are, meaning their pre-existing healthcare. It's the risk of being in a setting where perhaps people aren't trained, dealing with understaffing, as all of healthcare and caregiver industries are dealing with. And just needing in a really quick way, a lot of training, a lot of support that I think it was hard to meet. So we know, and I know the media here today may have, be looking at our California COVID dashboards. I think AARP, the Association for Retired Persons, they have a dashboard as well, and noted that in September, there were still many facilities across the nation that are not fully vaccinated and boosted. And that, in fact, many are also understaffed. And I want to at least a quarter report understaffing at some point in the recent period. And the problem with that is there's incredibly good data, much of it done by Charlene Harrington at UCSF, that shows that nursing ratios, as they go up, infections go down. So the more attention and healthcare people can get in where they are in a nursing home, the less COVID risk there is. And so that's another thing that worries me, is understaffing in some of these settings. And so I think we know vaccines save lives and reduce mortality, that people who are unvaccinated are 3 times as likely to pass away from COVID compared to people who are vaccinated. So we want to keep our eye on that and ensure people access to life-saving vaccines. And then really to echo everybody's comments, I hope that what people might take away in thinking about why people in nursing homes or assisted livings don't seem to have access to the same full rights is just that we need to remember that everybody in a nursing home is our neighbor, a part of our community. They are, we really separate out the issue and act like it's away from us somehow, but it's an equity issue. It should be on the equity dashboard like everything else. It's, it's related to, I think, the impact of ageism and ableism in our society, that we sort of put a dotted line around nursing homes and assisted livings, and kind of put the attention on them in a different way than somehow we do on other health issues and other health populations. So I think, and then we see that in the lack of attention on fully ensuring that everybody there has the rights that they deserve. And one thing that always really underlined for me the fact that folks from the health perspective are really as much in our community, even though they're living in a particular building, as anyone else, is every time rates go up in our community, they go up in a nursing home. If we're talking about any infectious disease, these are places where people are, obviously particularly staff, but hopefully the residents themselves and their family and loved ones are going in and out every day. There's no, hard stop at that door that really separates them from the rest of us.
Yeah.
So thank you so much. I appreciate the opportunity to make some comments, and do hope that we can ensure that, as the virus counts go up, that we can ensure people have access to vaccines as a basic right.
Thank you. I know several of our speakers changed their schedules to be on today's call. If you can't stay, could you just check the questions on the chat and perhaps answer them? And before we go to Reading, to the front line of a facility, I want to ask Ms. Hickman, as the premier advocacy group for older adults, justice and aging, is there a particular issue around rights of long-term care residents that justice and aging is focused on now?
I think always our focus is on the right to person-centered care, and this issue of access. And what we really focus on is advocating and educating both the public and residents and their family members about what their rights are, and helping and supporting them in enforcing those rights. So I would say that is our sort of number one concern, and making sure that is done equitably. That as many people as possible in our community are aware of what those rights are and are able to avail themselves of the enforcement mechanisms that are available. And then I think equitable access to quality care, I think, is on the forefront of our mind at all times. And whether that be by addressing reimbursement rates Medicaid reimbursement rates that desperately affect low-income persons of color and their ability to access high-quality care, or making language accessible materials so that people can inform themselves of what the enforcement mechanisms are that are available. All of those things are, I think, foremost in our mind.
Sandy, if I may, this is Blanca again. I just wanted to also, with the problems that we're seeing, and I want to talk about, and we know that there's short staffing. We know staff are not paid livable wages. We know their conditions are very difficult. It's a very difficult job to be an aide, a certified nurse assistant, an LVN, and other staff that work in nursing homes. So what are the things that California is doing? And I do want to shed some light and hope in this discussion, that the focus in California is to increase and improve wages and working conditions for people who are caring for older adults, for the people who are in the long-term care facilities, because we do know that it is a very important job. It could be a very challenging job, but it's also, people do it because they want to do it. They want to help. And it can be a very service-oriented job, very satisfying. So California is moving. There are some things we can do to improve. And one last thing I would like to say, one of the reasons we believe that we are seeing an increase in and physical abuse even, and emotional, is that we need to do better training with staff and even others that work with individuals in facilities that may have dementia or other dementia related conditions, and they have behaviors that somebody's just not dealing with it correctly.
Okay, thank you. I'm going to pivot now to Redding, California, where Jerry Kirouac, who is a ombudsman, as we said at the beginning, for working with many, many agencies, but particularly concerned about bringing the residents of a veterans residential care facility in Redding, veterans who are among the most honored in theory in our population because of their service, because they have put their lives at risk to defend the country, where he has brought 3 residents together, and as veterans are particularly concerned about the right to vote. This is one of the rights I mentioned, the right to culturally appropriate food, and the right, as Connie Nakano has said, to celebrate your culture on relevant holidays. These are things we just don't think about, in addition to the very important rights that Blanca, that Hagar, and that Dr. Chodos spoke about. So, Jerry, you can introduce our 3 speakers, and then I'm going to ask them a couple of questions. And thank you very much for joining us and for bringing our residents to the table.
Thank you, Sandy. I appreciate you having us. As Sandy mentioned a little bit before, my name is Jerry Kirouac, and I am the program manager for the Long-Term Care Ombudsman program up here in Northern California. With me today, I brought 3 residents here from CalVet, Redding's Veterans Home. We have Billy Thomas, Billy Ball, and Mandela Schwab. They'd like to share their stories with you today. And I would like to touch on one thing that you had mentioned. It's been kind of going across the meeting here, is one of the biggest problems that we have, excuse me, when it comes to residents' rights is actual lack of facility knowledge. It's that training and the quality and consistency going into the training. What we've seen regarding voting, boosters, vaccinations, is the facility is only as good as the whoever is running, the admin, whoever the director of nursing is. How involved are they in staying involved and up to date on the current events and what is actually relevant and new? Unfortunately, what you do see in a lot of more so in the residential facilities as opposed to the skilled, is you find some, honestly, you have employees that are a little apathetic. They're there for a paycheck. It is a lower paying job, and they do the bare minimum to just get by. And unfortunately, what that does is, if they are just getting by, they're not breaking the rules. They are keeping residents moving and going from day to day, but there's really no quality of life there. And the funny thing about that is, sad thing actually, is that facility can be a lower star facility, or what we would deem a undesirable facility one day, and they hire 2 new people, and the next week it's one of the better facilities in the area with more well-informed residents. So I would say that, you know, when it comes to the residents' rights, one of the most important things is making sure that our facilities and the staff are trained, that there's consistency across the board there. I'll get off my soapbox here. And
Okay. No, this is what, I mean, you are all opening up an area which I think many of us feel we need to know more about to do a better job covering. So let me go first to Billy Ball. Thank you, Mr. Ball. Could you tell us a little about yourself and what rights as a resident of the Redding Veterans Center, and as somebody who pays attention to the issue of rights, what right are you most concerned about?
I'm 84 years old. I live been in this home 3 years, this coming February. This place is good for me. It, like every other place that you come to, is there's always problems or complaints that everybody has. But I'm very satisfied with this home. I'm very satisfied with the lower staff that works here. I think they do an outstanding job. They're just understaffed. And
What
basically, this is meant for me.
if you had to emphasize the right to vote? Why is this a particular concern? Maybe not at Reading, but in other facilities. Could you share your thoughts about the right to vote? Since we just had the midterms, which are still playing out.
Yeah, I had no problems. I did the mail-in ballot. I've been doing the mail-in ballots for the last 10 years. I've been doing that. So I had no problems, and I've heard of no problems in this facility of people complaining about their voting rights.
Well, that's a very good report. Thank you. We'll come back to you. Linda Lejau, how about you? What are the rights of residents that matter most to you?
Okay, I'm Linda Lajoie, and I've been here 3 years as of October 30th. And I'm 77 years old and a Navy veteran. And perhaps my key thing would be equitable treatment across the board to everybody. And I'm not sure how to attain that. What I mean by that for me is that sometimes in certain instances, I find a lack of conflict resolution as from the administration portion, not the lower staff. I love the lower staff. I'm constantly praising. They do a terrific job. The nurses, the CNAs, the cleaning people, the kitchen staff. But there's they need some, the upper management needs some conflict resolution skills, as far as I'm concerned. But
could you give us an example of a conflict?
I'll give you a personal example of mine. Was that a fellow came, I do some volunteer work here as well, and I did volunteer work, and this fellow and I had a disagreement, and he became very volatile to the point where someone had to remove him from the area where I was working. And it went to the RCFE administrator, and she came and talked to us each individually, but nothing was ever done. She wanted the other fellow to cool down. She wanted the fellow to cool down first. And then it was kind of the attitude was, well, it would just swept under the rug like it never happened.
Right.
And yeah, so that that bothered me. I personally have conflict resolution training, but also in this particular incident, we each had a part in it. We each knew we had a part in it. And it would have been wonderful if the administrator had just sat us down and said, okay, I've heard both sides, and it looks like you guys just said the wrong words to each other, and we would have been happy. We have since reconciled, but it just, it was literally swept under the carpet, and with a simple word exchange that could have been resolved with a third party. And the only reason a third party was involved was because it happened in a public area of the facility. Yeah.
Right. Thank you for that. Billy Thomas, can you tell us a little about yourself and what your concern is over the rights of residents?
I'm Billy Thomas. I'm 79 years old. I've been in the Army and Marines. And my concern is there's not enough, I say, communication. There's not enough communication here. it's like Linda said, you go to the doctor or they say you gotta go through the chain of command, and it never turns, it never gets there. And the communication here is under the table half the time.
You know, were you able to vote in the last midterms?
Oh, yes, I vote all the time.
It's so inspiring, and I would just say to my colleagues, you know, we kind of forget that there are registered voters, like at Laguna Honda in San Francisco, 400 registered voters. And that means everybody's, I mean, you're the people who put this on top of my head. I was talking to Jerry about your concerns that made me realize how important the right to vote was for people living in long-term care facilities. One of you apparently had problems with proving that you were cognitively able to vote. Jerry, am I misremembering that story?
Actually are not. Unfortunately, that resident was not willing to take part in our meeting. They weren't comfortable sharing. But you're absolutely right on that. One of the reasons this all came about is because a common misconception out there that residents feel, especially when they're diagnosed, they get some sort of a diagnosis of dementia or Alzheimer's, something where their cognitive ability has been officially checkmarked in some sort of doctor's document, taking away their ability to just be who they've always been. People seem to think that they lose a lot of rights when that happens. And the only entity that can remove your right to vote is the courts. So there are felons, obviously that's one issue, but other than that, there are very few ways that you can actually have your right to vote taken away. And that is one of the biggest misconceptions, and especially our smaller facilities. Here at Calvet, and one of the reasons why I wanted to introduce you guys to Billy, and Linda, is these are three very well-informed residents who know their rights very well. And I feel like they are able to speak to, when they bring up an issue, it is definitely a valid one. As many of us in the ombudsman community can attest to, sometimes the complaints and stuff that we come across we address everyone with the utmost importance. But sometimes they are a little smaller, so a resident took another resident's back scratcher. We still go out, we still talk to the residents, we still address that, because to those two residents, that is the most important thing that's going on in their lives right now. That's the most important thing to them. And as an ombudsman, our job is to go out and advocate for those residents to know their rights. And a lot of times what happens in these situations when people get Alzheimer's, dementia, is they do lose that sense of self. Things that they did daily, hourly, monthly, for their entire lives, they now question themselves if they're allowed to do that, because all they've had over the last X amount of time is rights and things and their ability to do other things taken away. And so eventually people kind of become defeated. So making sure that the facilities are all, again, kind of comes back to that quality and the consistency of training. But making sure that the facilities are up to date and they have the correct information that they can then turn and pass on to the residents is the most important thing.
Right. Thank you. I'm going to devote the last 10 minutes. I've looked, there's some wonderful questions, and my deep thanks to our speakers for addressing some of these questions on the chat. I would like to ask each of our speakers to highlight what you think we in the media space, particularly media serving often very older populations, because ethnic media tends to skew, especially in language media, to older populations with limited English proficiency. What do you think we can do to raise the awareness not only among our own families, that loved ones and friends in facilities do have rights, that as Ms. Dickman says, there's actually law that gives us the right to challenge if we think these rights are not being recognized. What can we do that will support the rights of residents in facilities, and God forbid that these facilities go dark as they did during the pandemic, where we weren't able to access or know what was going on. So almost like a manifesto of rights, we have to keep this at the forefront of our coverage. But let me start with Blanca Castro,
Sure.
then go to Hagar Dickman, then to Anna Chodos, and then to our wonderful panel of residents. So Blanca, what can we do a better job covering the rights of residents?
What we're doing today, first of all, is asking residents and making sure that they have the voice. So even having these three individuals, and thank you for your service for each one of you. We want people to know, first of all, think about it as your civil rights. You have a right to be treated with respect, dignity, and you have a right to equality of life. And that includes being informed. Information is power. And the only way that we can share information is by letting people know that if they are not happy with how they are being cared for, they do have the right to voice their concern. Every facility in California, long-term care, and that doesn't mean just skilled nursing facilities or just assisted living, but anyone, they must have posters up that say, if you have any complaints, you can contact your long-term care ombudsman, and they should have, at the minimum, the crisis line. And you have a right to contact and file a complaint, no retaliation. And you do also, and I think this is important for families to know, you as a family member have a right to also be informed. And when it comes to administrators, they don't get away with not communicating. So I would encourage, in closing, if you have facilities such as the three individuals who spoke today, Billy and others, you can help form your own resident council in the facility. You can organize as residents, and you can also organize as family members. And you have the right to do that. And you can, in numbers, bring up issues like what you just described. It's much more powerful, and ombudsman can help you with that.
Thank you. Ms. Dickman, what do you wish there was more coverage of on this issue, especially by ethnic media?
I think continuing that, and I actually was going to talk about family councils, so I'm glad Blanca brought it up. I think continuing to talk about not only what the resident rights are for individuals in nursing homes, but also what the options are for pursuing and enforcing those rights, and how to pursue them, and who can help, putting people in touch with the long-term ombudsman, which can play such an important role in both resident and family education, and in getting people in the right direction, moving people in the right direction, and then really promoting the idea of creating family councils as a way to advocate for resident rights collectively, because this could be a particularly powerful tool. It brings in community and family members into a collective advocacy effort, and can help really combat vulnerability that's brought by the isolating factor or nature of being in a nursing home. It also advocates residents to self-advocate and reduce the fear of retaliation. And I think it's particularly important when we are talking about reducing disparities in care, because having such a collective effort really reduces the fear of race-based retaliation as well.
Could you send us so we can send all the media on the call any actual reports or links to reports you have that show disparities, particularly because you've mentioned them several times, and it would be very helpful.
Of course. Yes.
Okay, Dr. Chodos, because Vaccinate All 58 is so committed to expanding boosters and vaccines, I always feel this is the key takeaway we need to also make more visible for our media and their audiences. What should we do to help ensure residents of long-term care facilities are boosted and vaccinated first and boosted second? As you said, there are many facilities that may not have complete vaccination rates.
I do want to tip my hat to the state and our public health leadership that did mandate a lot of this and had certainly our governor's support in doing so. And I think, you know, what I've been really taken with is how useful, important, essential all the voices of the residents, like we heard from today, are in bringing all this home and ensuring that we don't have a total shutdown as we did before in the context of another, you know, additional outbreaks or pandemics, that we give people options and we hear from them what they want and find creative solutions instead of total shutdowns. And all I can think is that a way to reach residents and ensure that they're getting the health care they need, including the super crucial access to vaccines and even treatment for COVID, if you happen to get it, is ensuring that residents' voices help guide the way and how we can partner with them to get them healthcare that our public health departments are hearing from them. And so, you know, from the media side, the more we can elevate those voices, understand how they've gotten healthcare and how we can ensure more and better care. It was really nice to hear how great the healthcare has been for the residents, you know, all three of them that we heard from, and I'm so grateful that they were here today. But it just sounded like more, you know, that on behalf of the staff and on behalf of them, it would be great to have more care providers.
Right. Let me go to the four of you at Reading. To what extent does media, do you think about calling on media or hoping media will do a better job? And I realize there are not a lot of ethnic media in Reading where you are. There are a couple I can think of community media, but what would you like to see better covered? And I apologize for going over the hour, but since we started 2 to 3 minutes late, I think we have 2 to 3 minutes to play with here. Let me start with Billy Thomas.
The overhaul that start from the top and working down and get everybody working together, because it's hard, like you said, it's like we are a family here, and we should stick together. And a lot of these people complain. I said, well, if you're complaining, write it down. Let us know what you want, and then we'll know what you tell you.
Well, I'm just thinking this would have been such a great panel for Veterans Day. I swear to God, next year we're going to come back to you and ask you to share your stories. But your point, Billy, about communication, improving communication, that goes right to our key vision as journalists, is to improve communication. So thank you for that. Linda, what would you like to see a story about in media, especially ethnic media?
I would like to see more involvement with the community. I've only attended one or two meetings, but there's a support group. And we went to that about an issue we were having here, and we got terrific response from the community. And I think as with anything, if there's a media involvement, conditions are usually better. I'll put it that way, because it's like having a watchdog, is what I'm trying to say. Although I didn't find it personally, I didn't find it necessary. I will say this about voting. They were right on top. I voted in every election, and the social worker, when I came in, gave me the change your voting place thing. I did that. I also called the county office to make sure I was registered, because I came up here from San Francisco and I was very skeptical about everything. And I enrolled in Track Your Ballot. And so I got word that my vote was counted and everything. So I would like to see just an oversight, more interaction with the community.
Right, which is what media is supposed to play the role to do.
Right, right.
Finally, Billy Ball, what would you like to see a story about in the media?
The support group that Linda was talking about, I've been a member of that support group for almost 2 years now. So I go to every one of their meetings when I'm able to. Anyway, it's great if the media, they have one member in that support group that is very close to the media. He's well known in this area, and he gives us kind of directions in the support group, and anybody that goes to that meeting or to their meetings get well informed, and he always gets access to the media if we ask him to.
Great, thank you. Jerry, you have the last word. Is there a single thing you'd like to tell us all in the media?
Obviously, residents are first, but one thing consistently that I hear across the board as we help individual residents and families is so many people just don't even know about the Ombudsman program. They don't know that assistance is out there. They don't know that they have people out there advocating for them. If there's one thing in the media that you guys could do is spread the word of the Ombudsman. One of the things that our wonderful Ombudsman coordinator, Lonnie Golick, likes to say is the Ombudsman is one of the best kept secrets in the United States. We've had residents that are dealing with an issue. A facility won't refund an extra payment, and they've been dealing with it for 6 months because the facility just says, no, we don't owe it to you. The Ombudsman gets involved, and 6 days later, that resident has their refund back. It's just another layer of defense between the resident and the facility, because what ends up happening, and this is inevitable, you have people that are taking care of people 24 hours a day, 7 days a week. Now, our residents, this is their home. They are to be treated as if this was their own residence that they lived at their entire life. The problem is that staff loses sight of that. They take care of these people. And so you end up with the caretaker-patient relationship as opposed to an assistant helping a homeowner or somebody who is a resident of the facility. So you end up with this skewed dynamic. Again, it comes down to residents feeling like they're losing rights. So the more that we can just get the Ombudsman's name out there and what we do into the community would be a benefit to our residents. Thank you.
Thank you. This has been incredibly helpful. I'm so sorry to our media. We weren't able to go directly to you. We were too greedy. We wanted to bring the very best sources to you, and we've run out of time. But I think this has been incredibly moving and inspiring. Thank you to our residents. Thank you to Ms. Dickman at Justice and Aging, to Dr. Chodos, and to Blanca, Castro, and Jerry. Thank you. Ombudsman is now very important as part of the coverage we will do today, certainly. Thank you very much. Our briefing is now adjourned.